How's it going
Hey,
today?
Martha, good to see you. How you doing?
Good to see you. Hi, John. How are you doing?
Rounding to influence is really important.
Hi, Catherine. How are you doing today?
Brad, I'm good. How are you?
It really takes less than 5 minutes.
That's good to see you. Do you have just a few minutes to talk about safety behaviors?
Sure.
Managers are not there just to make sure the budget's in order, make sure people are working. They're actually interested on what's going on the unit.
Well, I know you're a safety coach, so this might be an easy question, but I'm interested in knowing one of your favorite error prevention techniques.
That would be peer checking.
Well, I use STAR a lot. Every time I give medicine, which is multiple times a day.
It gives a sense of urgency to the team as far as making sure that they're, not just meeting your expectations, but understand kind of about the processes.
Will you give me an example of when you've used this technique?
We had one just the other day.
Can you give me an example when you've used this technique in your daily work?
One of the doctors that's been here forever, he writes the same prescription every day. It's usually for 0.1 clonidine. We got in a hurry the other day, patients talking to him, got real noisy, and he wrote 0.4.
Right.
Well, had we not read it back, he would have ended up dosing a patient 4 times more than he'd intended to.
I stop, I look at the order, I make sure that I have the right medicine and it's for the right patient. Then I will give the medicine, checking my 2 patient identifiers. Then I will go back, I'll check the order, sign it off, and then check the patient later on to see if the med was effective.
When we told him, are you sure you want 0.4 and not 0.1? He really thanked us. He was pleased. He said, I can't believe I wrote that. I was just, thinking about something else. So it saved some problems.
That's a really good example.
That's great. Medication administration is critical to the safety of our patients, so I appreciate you doing that.
Do you have any conditions that make you concerned you're going to experience an unintended error or mistake that could result in patient or employee harm?
If people do have a concern, they can go ahead and express their concern.
I get used to the routine, and I think I can do it without checks and balances. And sometimes I don't pay as much attention to the guidelines as I should. And I think that happens with all of us when we get in a hurry. We think we know the routine, and we do for the most part, but that's when we can get a little slack with that, using checks and balances, autopilot.
It's just a matter of having the courage to say, hey, can you take a moment and look at this? And it doesn't take a whole lot of time.
Well, our 15-minute rounds that we do here are one of the most important things we do in terms of safety. So I guess if those weren't being done on time, that would be a concern.
I'm glad you brought that up, and my commitment to you is that we'll go back in our safety huddles and we'll make sure that's a focus. So I appreciate that.
And I just think it's important to be open to feedback and get that feedback, because second set of eyes.
This isn't about blame. This is about teamwork. This is about consistency and making sure that we're improving our processes.
And we all make mistakes, so it's helpful to know that we have someone else looking at what we're doing so that they can point those things out to us before the mistake makes it to the patient or the team member.
Well, I would like to ask you to commit to 3 different things today. 1, will you work to develop this technique as your personal work habit?
Will you help others build the habit, recognize when they practice error prevention technique?
Will you share your successes using this technique with your manager and maybe at a monthly safety coach meeting?
Sure.
Yes, sure will.
I'll do my best.
It's not about just being visible in the units.
Good to see you, David.
Thanks, Martha. Good to see you.
It's truly about the leaders leading and influencing our culture of safety.